Hi there. Welcome to Anonymity 1D. My name is Dave. I have type 1 diabetes.
My name is Dr. Brian Snyder. I am Dave's endocrinologist. In this video, we will discuss what is insulin on board and how it can be used. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you. Hello, Dave. How have you been? Did you have any questions for me today?
Everything has been good. I did have a question about my insulin pump. I upgraded my pump recently and was trying to familiarize myself with all the settings. That's when I came across the insulin on board on the home screen. I have heard of it but never looked into how it can help in my diabetes management. Can you please explain to me what it is and how I should use that?
Sure. Insulin on board, or bolus on board, refers to the amount of insulin that is still working in your body and can affect your blood sugars. It takes into account all the boluses given over the last few hours. It does not take the basal rate into account. To understand insulin on board, let's recall how the insulin we use is different than the insulin that our body makes. The insulin that our body makes is metabolized almost immediately and does not linger. On the other hand, the rapid-acting insulin we use for diabetes management lingers. Let's take a look at this graph where the rapid-acting insulin is shown in teal. It starts working in 15 minutes, peaks in an hour, and keeps working for 3 to 5 hours. As you can see, the effect of the insulin keeps decreasing, but it is still active. This graph shows the amount of insulin on board, which means the amount of active insulin along this line, and time since the dose was given along this line. You can see how the amount of active insulin slowly decreases over close to 5 hours. So if your pump says there are 2 units of insulin on board, that means 2 units of rapid-acting insulin, probably from your last bolus, is still working.
That makes sense. How does this affect my daily diabetes management?
In a few ways. How you sometimes try to correct a high blood sugar, but the pump suggests giving a dose which is a lot smaller than what you would like.
Yes. Several times. Is it because of insulin on board?
Yes. The pump is constantly accounting for how much insulin you took over the last few hours. So if there is already a lot of insulin working, the pump calculates that it does not need the full dose for high sugar correction. If the pump delivers the full dose, the blood sugar may drop due to stacking of insulin doses.
I remember insulin stacking. When I was on insulin injections, I was told to wait 3 hours between 2 rapid-acting insulin injection doses to avoid insulin stacking. I was told I didn't need to worry about that on a pump. Is that because of the insulin on board feature?
Exactly. The insulin on board feature is continuously accounting for all the boluses you gave over the last few hours, how much is still working, etc. So you just need to keep entering your carbs and high blood sugars.
This makes sense now. Why is the insulin on board displayed on the home screen? How do I use that information?
Insulin on board is very helpful in several situations. One is exercise. If you're going to do something aerobic like running or cycling, and you have a lot of insulin on board, then your chances of your blood sugar going low increases. Then you may have to take some carbs to prevent that low. Another situation is if you are treating a low blood sugar and you have some insulin on board, you may have to treat with extra carbs at what you usually would to account for that active insulin. As you start paying attention to this feature, you will get a better idea of what to do with that information. Start with looking at your insulin on board when you anticipate changes in your blood sugars, for example, before activity, or when you are treating a low sugar. We can talk more about it at next visit to discuss what you observed.
Sounds good. Dr. Snyder, thank you. I did not realize how I could be using insulin on board for my daily diabetes management. I will monitor that now.
Sounds good. Let's double-check your settings and prescriptions, and then we're done. We hope this gave you a better understanding about insulin on board. Please check out our videos about insulin stacking and active insulin time, which are related concepts. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.